Now, I know cancer is a heavy topic. It's scary, confusing, and easy to push aside, especially when you're young or feel healthy. But some of the earliest signs are so subtle, you'd never guess they're linked to something serious. In this video, I'll take you through 8 important cancer symptoms that you should never ignore, no matter your age or gender. These signs may seem subtle, but spotting them early could literally save your life. Let's start with the first one. Sign 1. Unexplained weight loss. I know we all secretly wish we could drop a few kilos without trying, right? But when your clothes start feeling looser and you haven't changed your diet, routine, or exercise, it's not always something to celebrate. Unexplained weight loss, especially when it's more than 5% of your total body weight over a few months, can be your body letting you know that something's not right. According to the World Health Organization, sudden unintentional weight loss is one of the earliest signs in several types of cancer. But it often doesn't come with pain or discomfort. You don't feel sick. You're not tired. In fact, sometimes you might feel normal, just lighter. But what's actually happening inside is that cancer cells can speed up your metabolism or hijack nutrients in the background, slowly draining your body without setting off any alarms. In cancers like pancreatic or gastrointestinal cancers, the tumor may affect how your body absorbs food, or it could release substances that alter how you break down fat and muscle. It's a subtle sabotage. This is why it's important to notice your patterns. These small signs build a bigger picture. So just keep track. That's it. The goal isn't to jump to conclusions, it's to stay alert so you're never caught off guard. Sign 2, unexplained and persistent fatigue. Sometimes what we brush off as just fatigue is anything but normal. I'm not talking about being tired after a long day or pulling an all-nighter. I mean a constant, unshakable exhaustion that clings to you even after resting. The kind where sleep doesn't fix it, coffee doesn't touch it, and your body starts to feel heavier, slower. This kind of persistent fatigue is one of the most under-recognized early signs of cancer, and it shows up even before the disease is diagnosed in many patients. Why? Because cancer, especially types like leukemia, colon, or stomach cancer, can cause internal blood loss, hormonal changes, or even release inflammatory proteins that interfere with how your body produces energy. It's like something's draining you from the inside, and no amount of rest can refill the tank. You might notice it slowly creeping in. Maybe you used to do 10 things a day, and now 3 feel like too much. Or your muscles feel sore for no reason. Or you're skipping plans, not because you don't want to go out, but because your body just says, nope. When your energy dips for a day or two, that's fine. Life happens. But when it sticks around, when it starts affecting how you show up in life or how you feel in your own skin, it's a sign you shouldn't ignore. Don't write it off as I'm just lazy or I'm just getting older. If it's not you, it might be something else, and that deserves your attention. Sign 3, unusual bleeding or discharge. Now here's where it gets a little alarming, but important. If you're suddenly noticing blood where there shouldn't be any, it's not something to brush off. I'm talking about things like coughing up blood, blood in your stool or urine, or even unexpected vaginal bleeding between periods or after menopause. Sometimes it's so subtle that people think it's just a one-time fluke or something harmless, but when it keeps happening, or even if it happens once and feels off, it deserves attention. What's scary is that these signs are often ignored because they don't hurt. But blood showing up in unusual places can be linked to cancers. And no, I'm not saying it's definitely cancer, but it's one of those red flags your body might be waving quietly. A simple practical thing you can do. Track the pattern. Note the frequency, amount, and whether it's accompanied by other symptoms like pain or weight loss. That way, if you do go to a doctor, you're not walking in empty-handed. You've got something solid to show and get treated accordingly. Sign 4. Persistent changes in bathroom habits. Okay, this one might sound awkward to talk about, but your toilet routine says a lot more about your health than you think. If you suddenly start noticing ongoing constipation, diarrhea, or a change in the shape or size of your stool, and it lasts for weeks and months, not days, it's worth paying attention to. Same goes for bladder habits. Are you peeing more frequently? Is there discomfort? These aren't just random body signs. Changes like these could be early signs of colorectal or bladder cancer, or maybe it's just a simple dietary issue or an infection in your body. So don't normalize them. Maybe I just ate something weird, or I'm stressed, that's why. But when your body's routine changes and doesn't bounce back to normal, it's trying to tell you something. So, keep an eye on what's normal for you. If something feels off for more than a couple of weeks, don't brush it under the rug or keep second guessing. Recognizing patterns early gives you a head start because your body doesn't make changes like this for no reason. Sign 5, a lump that doesn't go away. Sometimes it starts with something as subtle as a lump under your skin. A small, painless bump in your neck, breast, armpit, groin, or even just under the skin of your arm or leg. And not all lumps are dangerous. But when they feel hard, don't move around easily, or slowly get bigger over time, that's when alarm bells should go off in your head. I've seen how often people ignore this, thinking it's just a muscle knot, a cyst, or maybe a swollen gland from a cold, and even if that was the case, it's always good to get yourself checked regularly. But when a lump doesn't go away within a few weeks, or worse, keeps growing, your body's trying to flag something deeper. Especially in women, this could hint at breast cancer. In men, especially younger ones, a firm lump in the testicle could be a sign of testicular cancer. In both, lymph nodes that feel unusually large and persist without reason might point to something going on in the blood or immune system, like lymphoma or leukemia. The key here, it's not about panicking every time you feel a bump. It's about staying aware. If you touch or feel something new and it just sticks around too long, don't wait for it to become a problem. That quiet little lump might be your body's earliest signal that something's not right beneath the surface. Keep track of it. If it changes, tell your doctor. Early awareness is your secret weapon. Sign 6, persistent and unexplained pain. You ever get those moments when your body just starts hurting for no reason? Like a deep ache in your bones or joints, or a dull, nagging pain that keeps following you around no matter how much you rest, stretch, or massage it out. I know pain is such a common part of life that we start brushing it off. It's just from sitting too long, or maybe I slept weird. But when it doesn't go away for weeks, or even gets worse over time, it's not something to ignore. Persistent, unexplained pain can be the body's way of screaming something it can't say in words. Bone pain, especially, has been linked with cancers like leukemia or bone metastases, where cancer from another organ spreads to the bones. And lower back pain, that could, in rare cases, be tied to cancers of the prostate, colon, or even the ovaries. And no, this isn't about making every ache a big deal, but when your body starts sending the same pain signal again and again with no obvious injury, it's not being dramatic, it's being protective. A good rule of thumb I use? If the pain lingers more than a few weeks and doesn't act like your usual cramps, sprains, or soreness, it deserves a second thought, maybe even a conversation with your doctor. Trust your body when it whispers, before it has to scream. Sign 7, changes in skin color and moles. Changes in skin color, like yellowing or the sudden appearance of new moles, could be a sign that something is wrong in your body. While many skin changes are harmless, some can indicate health issues that need attention. For example, jaundice, which causes yellowing of the skin and eyes, can signal liver or pancreatic problems. But don't panic. This could also be due to less serious conditions like infections or liver issues unrelated to cancer. When it comes to moles, any sudden changes, like size, shape, or color, should not be ignored. These can be warning signs of skin cancer, such as melanoma, especially if the mole has irregular borders or multiple colors. If you notice any new skin color changes or moles that seem to be growing or changing, make an appointment with your doctor. It's always better to get things checked out early, even if it's something simple. Sign 8, persistent fever and night sweats. If you're dealing with unexplained fever or night sweats, it can be concerning, but it doesn't automatically mean cancer. What's important is consistency. If these symptoms last for weeks or seem to come and go without any clear cause, it's worth checking in with a doctor. These signs can also be linked to other conditions, and certain cancers can cause your immune system to release inflammatory chemicals that mess with your body's temperature regulation, leading to fever and night sweats. So early evaluation is key to catching any issues early and avoiding bigger problems down the line. So, take note of when they happen and talk to a healthcare professional. It's always better to get checked out for peace of mind. And that's it for today's video. I hope you found these signs helpful and informative. Remember, staying aware of your health is crucial, and if you notice any of these symptoms, don't hesitate to speak to a healthcare professional. If you enjoyed this video, make sure to like, share, and subscribe for more content like this. Stay safe and take care of yourself.